good afternoon, everybody. My name is John Marshall. I'm Vice President here at Colorado Mesa University. Welcome back to another Facebook Live as we try and work through our Safe Together, Strong Together updates for campus. We're glad that you're joining us. A quick bit of reminder, we have removed our masks during the course of this conversation based on the executive order from Governor Polis that asks we wear these indoors, but for giving television addresses and trying to communicate on important topics just like this. It's been an exciting week. We start week 2 here at Colorado Mesa University, and this is the second week in bringing back the Maverick family to campus. We were able to do baseline tests, given a clean bill of health under our belts for each of our students, faculty, staff members. That's now been tested. We're north of 9,000 tests, if you can believe that. It's a milestone that we're really proud of, and I know President Foster and the rest of the team has all marked that with some sense of relief. We are now here and we're back. This process wasn't without challenges, and we had to make some adjustments along the way, but we continue to learn and get better as we go. This week, we were able to have our football coach join a couple of our student athlete leaders at one of our local elementary schools. They welcomed their own students back to school, and we had a couple of innovative projects here on campus that we hope will help these schools and other community partners in the future as our entire community responds to this pandemic. And we'll talk about that more.
This is the biggest job we got, giving back to our community.
If you are wondering what's happening at CMU with the outcome of our testing program, you can follow our COVID-19 community dashboard. We're on the Safe Together, Strong Together website, and this is where we publish our data each week, trying to be very transparent, make sure that everybody knows exactly what's going on. The dashboard tool lets you see the number of tests completed, the number of cases that we've identified, and a host of other important metrics that help us assess how the response is going. These metrics include a positivity rate, which at the time, our 2-week trailing prevalence rate on campus, is about a 0.42%, or 0.4%, which is really great. Maybe I'll take a brief moment to expand on that. Those are all cases that we were able to find prior to them arriving on campus. This is all part of our pre-semester campus testing. And so what that's really allowed us to do is find those students, asymptomatic, almost all of them, and alert them ahead of time that they need to isolate and quarantine before they safely return to campus. So we've been able to do that, and we're really, really pleased about that. You know, when we first started these live stream events, Dr. Bronson and I spoke a lot about baseline testing, and today we want to speak to you about an innovation here on campus that we believe can help assist us as we track COVID-19 infections on campus as they occur throughout the semester. This project was designed by several of our CMU faculty with support from engineering students, which is always a bonus when we get to see students put their hands to work. We believe the project may have important benefits for others around the community, like the school district and others who have large or vulnerable populations to support during this pandemic. So, joining us today are 2 CMU professors among a larger team that's been working on this. Professor Carrie Schultes, who's a critical part of our engineering program, is joined here by Professor of Electrical and Computer Engineering, Michelle Mellentine. And these folks are supported by Dr. Scott Kessler, the department head, and both of these distinguished faculty members are working with students to design and implement our wastewater treatment testing program, and they're here today to talk to us about it. So, Dr. Schultes, Dr. Mellentine, thank you so much for taking time. We know that this is a really interesting and frankly a little bit cutting edge, and something that those of us who are not scientists and engineers maybe take a little bit of time to get up to speed on. So I wonder if we might start there. And Dr. Schultes, I wonder, since a lot of this was your brainchild, help those of us that are not professional scientists and engineers to understand what is wastewater testing. Can you give us kind of the wastewater testing 101?
Yes. So I'm so excited to be doing this wastewater testing here, and what we're doing is something that has been done in other countries for a few decades, and in some cases in the US, it's called wastewater-based epidemiology, and it's where we sample wastewater to understand what's in it. I think that a lot of us can relate to this from a more industrial perspective, because when you have a factory, it has wastewater coming out of it, and those factories typically have to monitor what's in their wastewater to ensure they're meeting regulations. And so it's a concept that regulators are used to in this country, and a lot of people are used to from that perspective. But instead of monitoring contaminants from a facility, we're monitoring what is in people's waste. And so the situation with COVID is that if you are infected, then the virus is coming out of your body. We call that shedding. So when the virus is coming out of your body, it's either coming out of your mucous membranes or it's coming out in your feces. And so fortunately, because it is coming out in your feces, we can monitor wastewater, and we can test the wastewater and understand how much, or if any, COVID is in there.
So Dr. Schultes, let me interrupt you real quickly. Why is this more advantageous than, say, the testing we're already doing, where we grab a student or a faculty member and we have them come and test? How is this advantageous? How is it different? Why is this such an important additional step?
Yes. So it's an important step in tandem with those steps. It is a critical step because you can monitor a lot of people prior to just doing individual tests. So if we're monitoring a dorm or a group of dorms that has a few hundred kids in it, or students in it, then we can understand if any of them might be infected with COVID before monitoring every single one of those hundreds of students, which is a lot more expensive. So it's the most economical and efficient way to monitor them, and you can do it a lot more frequently, because instead of getting samples from every student a couple times a week, we can just monitor their wastewater and understand at a population level, so what that entire population of that dorm or group of dorms, we can understand illness within that entire population.
Can you talk a little bit about the life cycle of the virus? Because it seems to me, when you first started explaining this, you can conceptually see why that's really helpful to get snapshots of a population. But the added benefit, it seems to me, is this idea of when the life cycle of the virus is detectable. So talk to us a little about where this fits in there.
Yeah. So when you are infected with COVID-19, what happens is you get infected, you ingest it in some way, and the virus starts to replicate in your cells. And it takes a few days for that to happen, to get up to a level that your immune system starts to kick in a way that that is significant and that you can feel it. So from the day that you're infected, it takes a few days to get to a concentration in your body where it's starting to come out of your body. So it has to take over enough cells and replicate enough times that it's not just infecting other cells, there's enough of it that it's coming out in your breath organ, it's worked its way down your intestinal tract into your feces, well, with your feces. And so from that point, we can start to detect it, but that's still days before anybody experiences any symptoms, if people do experience symptoms. So it's an early warning system for people who are going to be symptomatic. It's in this pre-symptomatic phase that I know we've heard a lot about. But for asymptomatic people who never feel any symptoms or understand that they're sick just from their body telling them that they're sick, they can go for weeks without knowing, unless they're tested or unless we detect it in their wastewater. So it's this critical early detection tool for pre-symptomatic cases, and it allows us to detect asymptomatic cases.
Yeah, it seems to me that, as we think about this across a population, this certainly plays a part. But on our college campus, it seems to me it has the potential to play an outsized role because, as you look at the number of cases that we've had, virtually all of them have been asymptomatic. Mm-hmm. So these are students who never knew in the first place that they were positive. They felt fine. They had no idea they were infected. Mm-hmm. And so the testing regime that allowed us to see that early on an ongoing basis, this really allows us a window into that, right? Yes. It allows us to start to see it. Okay, so let's assume for a moment that we're able to then get these snapshots at a population level. Help us understand how big of a population, where are you doing this, and which populations are we going to be able to get kind of a line of sight into, so to speak?
Yeah, so the university has prioritized populations that are in close contact with each other. So that is dorms. And that's a really easy place to monitor because everybody, that's where they go to the bathroom, that's where they live most of the time, except for when they're in class. So it's a good, steady, stable, non-moving population. And so that's what we've isolated. We've isolated specifically dorms with the most students. We've prioritized dorms with the most students that have a sewer system that we can get into. So most of the time, there are sewer systems, or there are manholes on the sewer system at certain intervals, and so we have to kind of be strategic about where those manholes are and what area is serving those manholes. So we've identified dormitories with a lot of students with manhole access, and that's where we're putting our samplers.
Got it. So not the entire population of the campus, but given some strategic windows into certain areas on campus that might allow us to see what's going on, particularly with our residential students, where we're clearly going to be some more concerned. Dr. Mellentine, I wonder if you might give us a little bit of context. What are these devices? How did you build them? How have students played a role in that? What exactly does this look like out there?
Yeah, so from an engineering standpoint, these wastewater samplers are actually surprisingly simple devices. What you have is a battery-powered pump that powers a pump which allows us to continuously sample throughout a 24-hour period. And over this 24-hour period, we can collect about a 5-gallon sample of wastewater from that specific location. And so if you want to kind of try to picture this device, if you picture a pump that's connected to a battery and you have a tube, one tube under the tube that's going to a 5-gallon jerry can that's being insulated and protected, and then you have another tube that's being fed down into the manhole, into the sewer, into the actual waste stream itself. And then at the bottom of this tube, you have a strainer to keep large items in the waste stream, such as toilet paper, from actually getting sucked up into the tubing and clogging the pump. One of the great things about this project is because it wasn't a extremely complex design, because it was a design that was relatively simple, it made it very straightforward to get all of the engineering disciplines in the building involved on the project. So most notably the Engineers Without Borders students, so students in this particular club, EWB, were able to actually prototype different designs for the ends of this strainer to keep large items from the waste from clogging the tubing. And they were able to prototype this rapidly using the facilities on campus. So we were actually able to use this special device in the fluids lab that's called a flume. So it actually will flow water at different velocities and different heights. So we could test to see how these strainers would work. And then those students were actually able to go to the site at which the sampler was going to be installed and see if the strainer that they tested was going to actually keep toilet paper out of for example, out of the pump, which is fantastic. So there was the Engineers Without Borders students, which is all predominantly STEM, but also non-STEM students who are working on campus to do all sorts of meaningful community and international projects. But it also included students from the Civil Engineering Club. And these Civil Engineering Club students actually made these housings that you can now see on campus as of this afternoon that are actually going to be these really nice boxes that they made to protect the sampler from basically any sort of accident or inclement weather or anything like that.
So again, lay people, we're walking by, we see this little miniature doghouse, and that's all we see, right? The work that's happening is inside of that small box and going down into the manholes, et cetera. And the engineering students have devised all of this. They
Exactly.
built this whole thing.
Mm-hmm.
That's amazing.
Yep.
So as you think about this going forward, we've selected, I think you said, a handful of different areas to sample, key areas strategically around campus. How many of these devices do you have deployed by the time, I guess, next week rolls around, the end of this week, et cetera?
Yeah, full deployment will be 4 samplers. And that will capture, I wish I knew the number off the top of my head, but on the order of about 10 dorm buildings.
Got it.
And about 1,500 students. For the students who do not have direct coverage of these samplers, we will be able to understand relatively what's going on kind of in all of the dorms representatively for the dorms that don't currently have samplers. But we are planning on long-term samplers for most facilities on campus.
So as we kind of look forward into the future here, we know certain elements about this, right? There's some literature out there. People have been using these for a number of years, but we don't necessarily know this SARS-CoV-2 burden and what that might look like. So there's going to be some trial and error, right? Some research here.
Yeah, definitely. Yes, just like you said, we're not quite sure what's going to happen on college campuses. As John said, the very first, run that we had looking at the infectivity of every single person, we found mostly asymptomatic cases. And CDC thinks that asymptomatic cases represent a smaller proportion of the population, so it's interesting that our population happened to have a higher proportion of asymptomatic cases. So we're learning every day, and we do expect to learn a lot as we start to move forward. Other universities are doing this, and everybody's kind of, learning on the fly, and everybody's sharing knowledge together so that we can keep improving best management practices without having to learn those lessons by ourselves. But yeah, everybody's learning. We're not quite sure what it's going to look like. We're going to be very responsive. We have a very agile team for understanding what to do with the data when we get it. And would it be helpful for me to talk about our response?
That'd be great, yeah.
Great. So in terms of responses, so what we expect to see is no COVID, right? That would be the goal. That's what we hope for. So there's a lot of different scenarios that we could imagine. We can imagine a scenario where there's no COVID, and then all of a sudden we see some COVID, so we can presume that somebody's sick. And at that point, we would, immediately implement increased public health messaging. We'd let people know what's going on, and then we're going to focus in on targeted testing and ensure that we can actually. The goal is to find that person and isolate them so they know, and everybody else knows and can be kept safe. And then we'll be monitoring trends over time. So, hopefully we've identified that person, kept them safe, and kept everybody else safe. And hopefully that's it. And the cases can start to, the loading is what we call the concentration in wastewater, can start to decrease. If that doesn't happen, we know that there's something else going on, and we can have a more aggressive approach or apply the same approach again. And then hopefully over time, we will start to see a decrease, and then we'll start to understand how our response has worked. And so we can start to, formalize and implement a repeatable response, and then we can start to move back toward more safe interaction in the dorms amongst its residents. So there will be cycles, there will be phases, and there will be learning along the way.
Yeah, interesting. As we've had, as I think all of our campus community is aware, we've worked just hand in glove through this whole process with our Mesa County Public Health Department. And they are so excited about us jumping into the middle of this. In fact, we're planning to host them on campus tomorrow to demonstrate some of the work that you all and our students have done, which is a really exciting development. It maybe bears mentioning for a moment how this fits into the overall strategy, and I think, Dr. Schultes, you're getting at some of this. But if you really pause and think about, kind of in your mind's eye, you can envision a pyramid, and the base of that pyramid becomes the ability to see a snapshot of hundreds or thousands of individual people in a given week, right? That's a lot. On the mid-level of that, we're still working on this idea of a rapid saliva test, and we're going to talk more about that, I think, in the coming weeks as we continue to work with some partners and do some research around this idea, where what we're really trying to get to is following the guidance and the feedback from some of our state public health partners who have really asked us to try and prevent overutilization and overburden from these PCR tests, and try and really focus those PCR tests on direct exposures and symptomatic folks, so that we're able to basically hold that resource for when it's needed most. We're able to get broader snapshots quickly for a number of students through our LAMP saliva testing. And then finally, as that base of that triangle, is this ongoing wastewater sampling. So really fits together as kind of a three-part strategy. And this is unfolding as we speak with the help of really great faculty and students. The beauty of this format, of course, is that we get to interact with you all live as we go, so we've got questions already coming in. The first one is, how is a university this size able to take all this on? Dr. Schultes, Dr. Mellentine, how have we been able to do this?
Well, I would answer that a few different ways. One would be from administration directing resources to us and ensuring, having the priority of student health. I think without that, this would not be possible. And then just support from a whole team within the university, within the Mesa County Public Health Department, within some other local partners, so that we're all information sharing as we go. But then also from students. Students have been a really big part of this. I actually just came from installing some of these these housings that are like larger dog houses. And so students designed those and built those and are installing them right now. And then the sampling equipment has been designed and is being installed by students as well. And so a lot of student involvement, a lot of faculty involvement, a lot of administration involvement.
But I would even just kind of take that one step further. I think the CMU partnership program with CU Boulder for the engineering disciplines on campus really kind of gives students to have this very unique small school experience for an engineering program that you don't necessarily see at a lot of institutions. And so like the students are very used to interacting with faculty in small groups and working on projects. And so, as a faculty advisor for Engineers Without Borders, for example, I helped the students, but we met, 5 times over the course of 6 days to iteratively test different prototypes. Tested a prototype, didn't work as we thought. Okay, let's go back to the drawing board and try something else. And so there's a very iterative process when you're trying to both execute a project quickly and move efficiently that I think, being at an institution that allows and really promotes these sort of like small classroom learning, hands-on situations in engineering really allowed the students to contribute in a meaningful way and a way that allowed us to get the whole system up and running quickly.
Yeah. It probably didn't hurt that you had a cutting-edge engineering building and some labs over there to do some work, right?
Yes,
Exactly.
that should have probably been part of the answer, yes.
All right. So the next question we have here is, looks like there's a question about the data dashboard. And so I wonder if we might pull that up real quickly. There's a data dashboard that's publicly facing. We've been updating this once a week. We're hoping to get to an automated data flow. Right now, we're still doing it manually once a week. But just really in full transparency, we're building out as many metrics as possible so that not only can our students, faculty, and staff see what's going on, but you as parents or other folks around the community can see really clearly what the COVID burden is on this campus. And again, that work is happening hand in glove with our friends in the epidemiology unit over at Mesa County Public Health. Okay, we have another question about, looks like, why are other people not doing this baseline testing, let alone wastewater testing? Shouldn't everyone be doing this? Yeah, I think look, starting back in April, I think all of us were sitting in this place of uncertainty and not really being clear. I give a lot of credit to our board and to our president who said, our students need this, okay? Our student body needs this. We serve 2 and 3 of our students are going to come from either their first in their family to go to college, they're a Pell eligible or a low income student, or they're a student of color. And traditionally, those students have not had a great experience at a distance. And so we made a decision, a mission-oriented decision, to get back in the classroom. And what that really did is it gave us 4 months to plan, to redirect people's time, to redeploy a whole team of people to focus on this work. And I don't think that, we're necessarily any more creative or brighter than anybody else, but we have made the commitment. And so I would just answer that the reason that we've got to this point is a joint mission that a lot of people have bought into, and a lot of buy-in from the team to do so. The question of should everybody be doing this? Probably. And I think our sense is if we can continue to innovate and figure these things out, because we're going to break some things, right? We're going to figure some things out that maybe don't work as we intend. But we're going to keep innovating and we're going to keep fighting to try and get a really clean look to keep our students as safe as possible. So we'll see where that goes. Okay, let's see. Susie's asking about people following the rules. And I think, Susie, your students' observation is the same one I've had. For the most part, people are buying into this idea. I had a great opportunity to visit with some of our students the other day a few of whom did not have their mask on. And I came over and gently reminded them, hey, get your mask up. And then I started chatting with them a little bit, asking them this question about how have the last 4 months been and everything else. And to a person, they said, we are so glad to be here. The masks, temperature checks, whatever we got to do, like this matters, we want to be here. And I think that's really what we're seeing mostly from our students is they're so happy to be back with their professors, eye to eye, doing the work that we're doing in the classroom and have some semblance of normalcy. So, it's early in the semester yet, but we've hired dozens and dozens of COVID ambassadors. These are student employees who are helping us remind students of compliance measures, safety protocols, and the like to try and keep this momentum all the way through Thanksgiving. So stay tuned, Susie. I'm crossing my fingers, but our students really have shown a lot of resilience thus far and commitment to that. Okay, we have, let's see. Oh, interesting. We've got a question here about another Colorado university's developed a new COVID test called RT LAMP that is done by mouth swab and can have results in as little as 10 minutes. Is that fast mouth test the one that I just mentioned? The short answer is yes, it is. It is a saliva-based test. We piloted this actually a couple of weeks ago, and we anticipate that this is going to start playing a bigger role as soon as next week. We intend on deploying this as part of our detection testing that we're doing with our students, faculty, and staff. So yes is the short answer. We are actively pursuing this work. We've been engaged with a lab out of Boulder, actually, that is doing this work, and we're excited to have them as we add to this overall comprehensive strategy. So thanks for that question. The next question is, has there been a positive case identified on campus yet? The short answer is no, there has not been. All the cases we've been able to find have been prior to them arriving and off campus. So we anticipate we will have a case on campus here eventually, but to this point, all of the cases we've been able to find, isolate, quarantine, and keep from getting to campus in the first place. So that's the answer to that question. Okay, let's see. Sorry, these are not coming in as overall student behavior regarding the new protocols. The question is, what has our overall student behavior looked like? You all have been in the classroom. I wonder, Dr. Mellentine or Dr. Schultes, how's your experience been in the classroom? How have students been engaging with you in the academic environment?
I've actually gotten a lot of interesting questions from friends that work at other institutions about, what the in-person teaching experience has been like this semester. And I feel like it's been overwhelmingly positive. The students, day one we came in and said, I said, this is the science by masks. Here we have anecdotal evidence showing that it works. Here we have droplet tests showing how well different kinds of masks work. This is how I want things to go in my classroom, and this is the science behind why. And the students are, I feel extremely safe in the classroom from the standpoint of when the students walk in, they know they have the mask on. I just kind of look at them sideways, even if they drop it for a second to take water, and they know it has to go back up right away. So I think, the students are very mindful that being in person this semester is really a privilege and something that they're enjoying, and they want to continue to have this experience. So I can only really speak to what the experience is like in the classroom, but I would say in the classroom and in the building, I've found that students, they come to class with their mask on, they keep it on for the duration of class, they wear it in the hallways. I feel, at least teaching at the institution, very safe.
Yeah.
Yeah.
What about you, Dr. Schultes? What's your experience been?
Yeah, it's been the same. I think the students have been great. It's been a great learning opportunity. So we get to talk about, because I teach environmental engineering and civil engineering, I get to really bring in the concepts of environmental engineering. So we get to explore these concepts in our classes, but also our class sizes are so small that it's been great. Everybody gets to stay really far apart. Everybody's safe. Everybody keeps their mask on. I think it's been unique. I think we've gotten to learn different things in different ways, and I've enjoyed it.
And the one thing I would add to that is it's kind of fun when you get to share your expertise with a student. So before I came to CMU, I actually studied mechanical ventilation, and I wrote predictive models to customize mechanical ventilation for patient-specific outcomes in an acute respiratory distress syndrome setting. So that's something where like I feel very passionate about trying to protect people, especially vulnerable populations. And so it's really great to be able to have these conversations with students and then also talk about all the engineering that goes into studying some of these diseases and how these devices work. And so we've had really great conversations, whether it be with a student club or just outside of class or even in class, you know, about some of the therapies that they've heard about in the news and just like other broader COVID topics. And I think being able to kind of bring that additional perspective into the classroom has been meaningful for them, but also has really been really a fun experience for me too.
That's great.
Can I jump on that too? I just want to say that, so that's been exactly my experience. So I used to work at the Centers for Disease Control and Prevention in these types of waterborne outbreaks, and I used to work with pathogens and inactivating them or making sure that they can't infect people. So same, it's just been so uniquely great because typically when I teach this stuff in my class, it's pretty interesting, but now the students immediately have something that they connect to. And so it's been really fun from that perspective.
Awesome. Well, thanks for sharing that experience. I see a few questions here following on. A few of you said that your students have maybe had a different experience where people are not following protocols. So let me give you a couple of thoughts on this. One, pretty important that we clarify, because I think some of this has been a communication issue with students in the university, to ensure that we're all on the same page about what our safety and mask protocols are. And so I'll just give a quick summary of that. If you're indoors, you're wearing masks unless you're in your residence hall with your Mavely. The other point would be that if you are outdoors, you don't have to wear a mask as long as you can maintain social distancing, or if you are with your Mavely. And I think some of that has been a challenge because I can't immediately know if Michelle and Carrie are in a Mavely and they live together as roommates and they're not social distancing and they don't have a mask on. It may appear to me that they're not being compliant when in fact they are part of that Mavely. So it can be a little bit challenging. There are other circumstances when you know that a student is not being compliant, and we've certainly had those moments. It's part of the reason why we've had to, I would say, be extra diligent in the residence halls, and in fact this week have gone above and beyond touching base with students. I would say right now there's several dozen students who are having a heart-to-heart chat with our director of student conduct because they have not followed some of those protocols. And we are going to treat that as a conduct issue. While on the one hand, a 19-year-old who forgets their mask to class one time, we're probably going to extend them some grace. Somebody who is repeatedly basically flouting those safety protocols, it's not going to go well. Ultimately, that student's going to get removed if they cannot abide by our rules. So the last thing I would say is if your student or you or anyone else out there in campus community is aware of someone who is not following safety protocols and so forth, one, bring it to their attention and make sure they're aware of it. And if they're deliberately doing that, make somebody aware of it. And you can use the Maxient report it function on MapZone. There's a little yellow box as you log into MapZone that says report it. And you can click on that and let us know about that incident so that we can follow up quickly and diligently and make sure that people are following safety protocols. We know that this is a privilege to be here, and as we tell students every day, it could go away if we're not careful, so we've got to be following those safety protocols. Thanks for the question. Dr. Schultes, if this project works, we've got a question here. If this project works, I think it will, how quickly can it be deployed to the community? How difficult will it be to deploy it to the community? And will students have a role in trying to deploy it with the community?
Great question. So I want to answer that two different ways. First, how do we define success? And how we define success is the collection of data. So it will be successful because we will be collecting data, and we will be responding to those data. And again, these responses will be iterative. We will learn as we go. And so that will be another part of success, is continuing to learn as we go and improve our response. So I think that those things will happen. I think that maybe the way that the question was asked is if maybe one way to define success would be if we can isolate specific students when they get sick, and that is the goal, and that is what we are working for. And as John was explaining, this is kind of the base of the pyramid to making that happen. So yeah, we'll all have to be working together in order to make that happen, but that is the goal. And then the community deployment question is such a great one and something that the university is really invested in. We are working with a lot of different partners in the community, specifically District 51 and the Mesa County Public Health Department. We've been in close contact with the city and the wastewater treatment facility, and what our goal is to deploy this community-wide for numerous reasons. One, because of course our faculty and staff have families, but our students also have families, and they're not isolated from the community. So we view the community as part of our family because it is. So we are invested in getting this out to the community as quickly as we can. And part of this first push with these 4 samplers is to develop the data and an understanding of an efficient response to those data in order to communicate to our stakeholders and partners, such as District 51, exactly what works, what didn't work, and how we're going to approach keeping the whole community safe. Nursing homes, really any communal living, so anytime people are living together, any communal living condition would be a good opportunity to look at this. Any closed campus, such as schools or even large businesses, maybe more manufacturing type businesses where people aren't coming and going all day, so you can kind of isolate that population and understand, if you're looking at their waste, that it really is just one set population, so you can understand what's going on with them. All of those questions are all of those populations we are really hoping to reach quickly, and hoping that our initial pilot can be used to get them resources and get them coverage. We want community-wide coverage here. That is the goal.
Absolutely. We have another question about student quarantine and so forth before, and then I have another question for the two of you, it looks like. So the question is how things might go for a student if they test positive, in terms of what that quarantine and isolation would look like. So on our website, if you click on it, on the left-hand side of the COVID, there's a link that describes what happens after the test, or I think maybe we call it post-test link, something like this. And what we've done is we've tried to lay out there for you a kind of a decision tree with some graphics, so that you can really quickly and easily see what that procedure might look like for your student. And so the first question is going to be whether or not they live on campus or off. And there's going to be a variety of other things that the contact tracing team is going to ask them. But if you look at that little flow chart, what it really starts to do is help you lay out kind of next steps. But bear in mind, it's going to include some version of our contact tracing team. And I think we had one of your colleagues, Dr. Kristen Human, who's leading that team, along with Dr. Bronson, here maybe a week or two ago on this, on our Facebook Live communication. And what Dr. Human and Dr. Bronson have done is really built a whole team of contact tracers, and there's an element on our website that you can go look at for that. And they've also built out a pretty comprehensive decision tree, so you can see really quickly and easily what that looks like. Now, all of that said, our Student Wellness Center, where we have nurses and doctors and others that are here in case your student doesn't feel well, needs a consultation with a medical professional, those are all things that are available and part of our plan. My last comment on this would be, without knowing the specifics, if you have any questions, call us or simply send us an email at safety@coloradomesa.edu, and we can get into the specifics and make sure that there are no questions and no confusion about how this should play out should your student test positive. As I said, out of a community of roughly 10,000, we have had thus far about 37 positives. And so we've actually had a chance to kind of exercise these muscles and figure out these protocols early on. So hopefully that answers your question, but if you do have follow-ups, please send us that email. All right, so one of the questions from one of our viewers is, a lot of folks have expressed, teachers maybe in particular, have expressed reticence to get back. One of our viewer says, you two seem really excited to be back. What's it like teaching in a pandemic, and are you excited to be back?
I think, before the semester started, I think I was like a lot of what I imagine what a lot of my peers were when I talked to them. And they were extremely anxious, just like many of the students were. So before the semester started, I sent out a survey to my students just to try to gauge where they were at as well in terms of do you feel anxious about coming back to campus? Do you have concerns about maybe your peers being compliant with all of the safety protocols? And I think, for me, all of those fears went away when I finally walked back into the classroom and I saw that the students were taking things seriously. And for me, it was not only just that, but there is extremely strong anecdotal evidence. There was this story earlier in the summer in the New York Times where there were the two stylists that saw 139 clients. And the two stylists had tested positive for coronavirus, or they didn't know it at the time, but they had coronavirus, and they didn't give their clients coronavirus. And I think, even if you wanted to kind of just and you look at all the other science experiments, so I did a lot of digging into the science to convince myself that I agree with the university. I think that mask wearing is going to be safe as long as I can keep this extra distance between myself and my students, and I've been able to do that. I can go into this room feeling confident that I can not only protect my health, but protect those that are in my social circle and my immediate family when I would go home. And so I think kind of the combination of really digging deep into the science and just seeing students, reminding students, hey, put your mask up, and not getting a single complaint ever about me enforcing that, I think is something that's took what originally was a very anxious feeling about being on campus and made it something that I feel happy to be back.
I could talk about this for 2 hours.
Yeah.
Because the university is really doing a great job, and that has really helped me feel a lot better. So facilities has gone through and calculated the airflow in every room, and part of the Harvard Healthy Buildings guidance is to understand how many air exchange rates are happening in your room, and they have this goal of 6 air exchange rates, and talking to facilities, if a room hasn't met that, then they're augmenting it with portable air filters, with HEPA filters. They went back through all of their HVAC systems and put in the correct filter size that's recommended for any recirculating air. They're increasing their air exchange rates with outside air so that we don't have to worry about breathing other people's air. So all of those factors help me feel safe. Of course, the mask wearing, and then all of the surface cleaning procedures that the university is engaged in. They've really dedicated themselves to making sure that our surfaces, high-touch surfaces, and every other surface is really clean. We had a little test run, unfortunately, back in the spring when we had an outbreak at a local high school, and at that point, our facilities people, responded the same way that the high school responded, and they bought something called an atomizer that ends up making surfaces. So when we think about surfaces and high-touch surfaces, we think about hard surfaces. But what about the soft surfaces that we can't clean and wipe down? And so there's these little atomizers that distribute a disinfectant onto soft surfaces to disinfect them.
It's like a mister, right?
It's like a mister. Yeah. Yes. So all of the layers of safety that the university has created have allowed the professors to be able to focus on teaching, fortunately.
Well, one question we have here is that responding to a note, looks like Terry's asking about President Foster's note that he sent to students last week, and referenced the slight warning to students living off campus and how these students are playing into this cutting edge on-campus testing. So let me maybe first address that. We've read all over the country about students who were enthusiastic to see each other again, right? And some campuses have had a tougher time managing that than others. I think we have tried to hit that head on and be really direct with our students that we know you're excited to be back, but you cannot have these huge house parties. That's not going to work. And so we've been really direct with our students about that conversation. The president has been very direct with our students. Law enforcement has been very direct with our students about this. And we recognize that, look, they're back, and as long as they're being safe, keeping it in those small family units, that we want these students to be back. It's why they're here, but we need to be safe about that. And so that was part of the reference that President Foster was making in his note. The second half of this is how do those off-campus students fit into this? And the short answer is immediately, not yet, but I think what you heard Dr. Schulte describing is we are not simply looking at this as our campus bubble, we're looking at this community-wide. And so our city and our county and a variety, our school district and others, where we are hoping to be able to take this more broadly throughout the community. But as we say, it's a series of layers of safety. And so no one of these is intended to save everything. And if you take one away, it doesn't bring the whole house of cards down. So those off-campus students will continue to have a variety of other safety protocols in place. But as of right now, they won't have access to the wastewater. But fingers crossed, maybe we can get there here in the coming weeks. Okay, we have another question about, looks like, oh, Shelley's making a question about having students spying on each other and tattling. Maybe seems a bit much. Yes, I agree with you, Shelley. And my hope is that we don't have Orwellian tattling on each other, but rather adult conversations with each other. I was in the quad the other day having a conversation with a student, and two people in a mask came up, and she gave me a punch in the arm and said, "You're only at like 4 or 5 feet." I said, "Okay," and backed up, and she said, "We're going to hold each other accountable, and I want to be here enough to do that." And my hope is that we are able to do that we're able to gently hold each other accountable, but we're able to do that face to face. So hopefully we don't get into too much of the tattling business. Okay, let's see here. We did have an opportunity, you know, we talked a lot about this idea of mission-driven reasons for being back. And we had a great example this week of engagement with our students, and I mentioned this at the outset, but you know, as our students are back, they don't just have an impact on one another, and this is not just an experience that is for them. They have an impact on our entire community, and I will tell you that just lifts the entire community's spirits. The Chamber of Commerce, the school districts, the hospitals, and these are all folks who have been able to chime in about how meaningful it is to have our students back in the community. But maybe the example of that was this week as we're out at one of our elementaries, throwing a football, playing with, and really trying to remind one, how to be, and two, how to continue working hard and aspiring to something. And so we're really grateful to be back, to have our students back, engaging in something that hopefully we can continue to build. So that, Dr. Mellentine, thank you so much for your work. Thanks for taking away from building houses here with us this afternoon. We really appreciate it much. Thanks, everybody.